Internet. How are you guys doing today? I hope you're doing well. Today we're going to talk about one of my most common things I see people for, and that is carpal tunnel syndrome. So a lot of people will come and talk to me and they'll be like, oh, I have carpal tunnel. And I have to resist from making super lame jokes about don't we all? Because we do. We all have a carpal tunnel. It is just an anatomical location. It is where the median nerve passes through your wrist and then into your hand, and it's covered by a piece of connective tissue. It goes by several names: flexor retinaculum, transverse carpal ligament, I believe, is another. So it's just little connective tissue, your median nerve, and then your carpal bones. So it is a small tunnel in which the median nerve passes. So what happens when you get carpal tunnel syndrome is that nerve is inflamed and the space isn't what it should be in there. So you can get pins and needles, you can get shooting pain up and down your arm, you can get numbness in your fingers. It can show up in a lot of different ways, but generally speaking, the pins and needles is the big one. A lot of people get nerve pain in the middle of the night that wakes them up. That's another pretty telltale sign of carpal tunnel syndrome. So if you're experiencing these, there's a fairly good chance that you have carpal tunnel syndrome. You can always go to your doctor. They can do an ultrasound. They can check and make sure. I think if it's over a certain number of millimeters, then it's official. But if you're feeling these symptoms, you can still do everything that I'm saying today, and it'll kind of help alleviate those symptoms, most likely anyways. And then if they persist, you can take extra steps. So what causes carpal tunnel is a question I get a lot, and it's an overuse injury. So that means you're using hands, forearms, all that stuff more frequently or more repetitively than we were designed to do, which is very easy to do. I think I've mentioned in previous videos that our society evolved way faster than our bodies did. So we are not designed for the jobs that are available today. We're not designed to work at a desk. We're not designed to have our arms out in front of us. It's just not what we were built for. So I think it's 3 million cases or something a week, a year. I don't know. I did research. I forgot the number, but it's common. It's very common. People get this a lot. And it always surprises people because they're like, I'm not doing anything. I'm not doing anything that should be aggravating this. Well, the truth of the matter is you usually are. So if you're working at a desk being like this all day, that's going to aggravate it. Also, a lot of the times carpal tunnel can start further up the chain. And that's because the nerve, the median nerve, actually starts from up in your neck. So what you have going on here, it's called your brachial plexus. Google it. It's really cool. All of the nerves that come down into your arm all start in these cervical vertebrae. They branch off, they go their separate ways, and then here is where they have the most distinct separation. And it's your radial nerve goes to your thumb and part of your index finger, and then your median nerve, which is the one associated with carpal tunnel, that goes to the other part of your index finger, your middle finger, and most of your ring finger. And then you have your ulnar nerve that comes up to your pinky. So a lot of the times your doctor, your physical therapist, your massage therapist, they might be like, which fingers have numbness or tingling? And that can kind of help them figure out where the nerve is being aggravated. Because a lot of the times you feel it in here, but it could be pinched up in here. It can even be pinched up in here. So keeping an eye on your posture, making sure you stretch frequently, those are all things that are going to help. And I'll go over some great stretches today. Just gonna check my notes for a minute. In addition to the stretches I'm going to show you, other things you can do for carpal tunnel is just regular self-care, seeing a massage therapist, seeing a chiropractor, seeing a specialist who can help you along this journey. And then also things like natural anti-inflammatories, so like an anti-inflammatory diet, taking ginger, turmeric, those sorts of things, using like analgesics, pain relievers, topical pain relievers, analgesic. That sounds right. Things like BioFreeze, or depending on what state you're in, CBD, things that you can like topically put on that'll kind of help reduce the inflammation and decrease the pain. And then there are some like vitamins and minerals associated with helping, like B complex and magnesium, but that kind of goes outside my realm of knowledge. So if you're more interested in the nutritional route, I highly recommend talking to a nutritionist. So, all right, with that being said, we are now going to go over the things that you can do for carpal tunnel syndrome. One of the things that may be prescribed to you by a physician that might help is one of these sweet bad boys. This is mine. I have carpal tunnel syndrome. Kind of helps keep your wrists straight, especially if you're waking up in the middle of the night due to that pain and numbness. That being said, I hate this thing and I do not wear it. I don't think it helped me at all. But that's because the majority of my carpal tunnel, I'm pretty sure, is from being a massage therapist and working really hard and not taking enough breaks and maybe not doing as much stretching as I should be. So I don't think wrist stabilization was the missing piece for me. That being said, that helps a lot of people. So don't rule it out. If you have carpal tunnel, that might be the missing link for you. But even if you're doing that, you can still do these stretches. The first of which is just a light wrist traction. Just going to kind of take your fingers here and gently pull. You can kind of maybe feel a little pop or two in the wrist. Just go nice and slow and easy. Don't force anything. If you're not a big fan of this, I have a tendency, what I will do is I'll interlock my fingers and then I'll just pull. And that kind of creates that space in that joint. I hope you could hear that. The goal isn't necessarily to crack, but I'm not mad when I do. So wrist traction and then some nice stretching. And you may need to warm up a little bit. Some of these might feel too easy. Some of them might feel too difficult. So just kind of go slow and steady and see what works best for you. Because depending on how severe your carpal tunnel syndrome is, some of these might be excruciating. So slow, easy. If you get any numbness, tingling while you're doing it, kind of back off from it. If the tingling or numbness, or if you get any cramping and it lingers, then definitely back up off of whatever it is you're doing and do a more modified version. So you can start, hands out. Oh, hey, hi guys. And then nice little like zombie arms. You can just do a few of these. In an ideal situation, anytime you're doing a stretch, you want to hold it for 30 seconds. These first few for me are more like the warm up for the real stretches, but it depends on what you're doing. You can make some fists, go in as far as you can, back out. Wah. Oh yes. So just some basic movement is going to help. And then if this is super duper easy, you can add a little bit of traction by using your other hand. Now with this, you always want to be careful. You never want to be like flinging things back. You just be careful, go slow. And then same thing with like, you know, you could do this. It's anytime your fingers are curled, like the fist, that is going to be a more intense stretch than when they're open. So use your other hand, get some traction. That's going to help a lot. Just nice 30-second stretches. Another thing with that is these muscles, they have multiple tendons. And they're multiple muscles for a lot of, there's so much going on in your forearm. Like there's tons of muscles, tons of tendons. So the more delicate a movement you can do, the more muscles and tendons you're going to need. So since we've got like all these little like abilities, dexterity or whatever, we need more muscles. So like this is great. What's going to be better is if you actually do one finger at a time, curl it in towards your hand. Curl it in towards your hand, grab it with the other hand, and then bring it in. And that way you're getting a much more targeted stretch. And you can do that one finger at a time, hold and stretch. And this is my personal favorite. And then do it on the other side. Oh, this one occasionally will make my forearm cramp. So let's hope that doesn't happen today, because that would be embarrassing. So one at a time, and then you can do kind of the same thing. I can't pull back one finger at a time. I guess I can. I'm doing it right now. I prefer to do like two. Just kind of get that stretch in there. But yeah, the more you separate, the more targeted the stretch. So those are all really good stretches. It's getting a lot of your forearm, both sides. Other stretches you can do are neck and pec stretches, because like I said, that's where all the nerve stuff starts. So I've actually already made videos on the pec stretch and the neck stretch, so I'll just link those in the description box below. They're really good stretches you can do on a regular basis. So we're going to move away from the stretches for a minute and do a little bit more of the self-myofascial release. That's the stuff like foam rolling, although for this we're going to use a lacrosse ball and this fun little like spiky ball I have. Or I always tell people you can also use a frozen bottle of water. So I'm just going to show you guys real quick what everything is that I'm talking about. I'm just going to disappear. Oh no, where did she go? She's gone. Okay, so this is a lacrosse ball. I use this probably the most frequently. And then little spiky ball. You can also use a golf ball, which I prefer. I prefer the smooth surface over the spiky stuff. But if I'm going to be completely honest, this was upstairs and the golf ball is downstairs. So, and then I also froze this bottle of water, because a frozen bottle of water is another great tool, and you can use it exactly the same as the lacrosse ball. I would recommend maybe a like slightly thicker bottle of water than this, because mine kind of froze elongated and not circular, which is very upsetting for me, but it does still work. It's just slightly more awkward. So with this, what you are going to do is get your ball of choice. I usually use the small one for my hand and then the larger one for my forearm. But for the sake of this video, I'm just going to use the same one throughout the entire thing. Yeah. This is a lacrosse ball. He is my friend. So you're going to find a nice flat surface. My arm is my flat surface for the sake of this video. You can also do it like this. But you're going to take the ball and you're just going to roll your hand. The more pressure you put into it, the more you're going to feel it. Not necessarily the better. It is a curve. Like, you can do too much pressure. So listen to your body. Whatever feels right is going to be what's right for you. So flat surface, roll up through the forearm, and then make sure you really get into this meaty area that's right by the elbow. This is where so many of those nerves come and attach. So if you can just get it right there and then rotate your forearm, that's going to be super helpful. It's nice and juicy, just like, oh, so good. And then you can do the same with this arm. It's a little awkward to try to roll it. So I actually usually do just roll it with this hand. And I do the same thing in regards with this meaty bit by the elbow. That's where a lot of things attach. So that's where I focus a lot of my attention. And then I'll rotate the hand. Occasionally it's difficult to actually roll something. So a lot of the times I will just place where the instrument where the knot is, and then I'll move the body part. So it's whatever's easiest for you. But make sure you really get into those thenar and hypothenar muscles, which is just like these guys here, down into the wrist, up, and then really get into these meaty parts. You can even stick the lacrosse ball here. We're going to pretend my fist is like a table, and then you can kind of roll up through here, or once again, just hold and then move the limb and just kind of like, I don't know what this motion is. I don't know what to call it. And you can even like windshield wiper it, karate chop it. That seems right. That could be this motion. So getting in through here, meaty parts. A lot of times I feel like carpal tunnel is centered around the elbow, just because that's where so much of the muscle is, even though the tendon comes down through here. So loosening that up can increase the blood flow, calm down that nerve, and then you'll have less of your carpal tunnel syndrome symptoms. Say that 10 times fast. And then most importantly, rest, which can be impossible because a lot of the times if you have this going on, it's due to your work. So if you're a dental hygienist, for example, you're like this all day long and you can do all these stretches and ice and stuff, but you still need to try to find some way to rest, even if it's not, obviously you can't not work, or maybe, if you can, maybe like cut your hours back, live your best life. But, making sure to take breaks. Take the lacrosse ball with you to work. When you're at work, use BioFreeze or something to try to keep the inflammation down. Have an ice pack at the office. Things like this that are going to kind of help nip it in the bud before it kind of starts, are going to be the most helpful. So anytime you can incorporate a stretch into your daily life, that's going to be the best. I do that with the pec stretch. There's one doorway in my house. Every time I see it, I'm just pec stretching. So if you can be like every, the first 5 minutes of every hour, I pull my lacrosse ball out of my drawer and I roll. It's going to make a huge difference. If the wrist brace is helpful, wearing it at work, that could help a lot. So just kind of self-evaluate, see what your situation is, see if you can make your life any more ergonomic, if you can insert any breaks anywhere, and then make sure to carve out some time for these stretches and this self-care because it's important. There are other more aggressive options for carpal tunnel, and I can tell you from personal experience, I have had the cortisone shot and it was kind of awesome, like excruciatingly painful. But then after a day or two, my symptoms were gone. It was amazing. And then, they eventually started creeping back. And so I wish I'd taken more advantage of that non-painful time and actually done more self-care, but without that pain reminding me, I was just like, oh, I'm fine, which is, I know better, but we're all human. So just, if you're at that point, I don't want to tell you not to get one, cause I would be a hypocrite, but talk to your doctor. But I really think that these stretches are going to be a lifesaver for you if you consistently do them, cause you can only get so many cortisone shots and they're painful, and eventually they're going to want you to do the surgery. That surgery cuts the retinaculum, and to create more space, and now my cat's meowing at the door. So that surgery for a lot of people, it's pretty helpful, but it depends on what you do. So if you have a computer job, it's more of an option, whereas if you have a physical job, like if you're a mechanic, a tattooer, a massage therapist, it can mess with your grip strength, and it's important for our jobs. So also, surgery should always be your last resort. Cutting into your body should never be your first thought whenever something's wrong. If there's healthy, holistic ways to take care of it, that should be your first option. So I highly recommend these stretches. Take care of your carpal tunnel so you don't get carpal tunnel syndrome. And I hope you guys have a great rest of your day. Thanks. Bye.